My name is Shelby Webb, and I'm here today with my 20-year-old female patient who has been responding to my questions appropriately. She is aware to who she is, where she is, and what time it is. So she's aware and oriented times three. She appears her stated age. I noticed that her skin color is good. It is a whitish pink. It coordinates with her ethnic background. Um, She has no physical deformities that I noticed. When she walked in, her gait was good, well coordinated with an even arm swing. She's now sitting here comfortably with her arms also comfortably by her side. Thus far, she's been cooperative with my questions, answering them well and pleasantly, and her mood seems to match her affect appropriately. Um, Thus far, she has been talking and articulating in a way where I'm able to understand the ideas she's trying to convey. Her words and conversation are appropriate for her age and her educational background, and her hearing seems to be intact as well, as she's been responding appropriately to questions and appropriately to commands and asking her to do different things. There's been no excessive asking for repetition of words. Okay, I think that's all. Okay, so from here we'll go ahead and start the physical assessment. Okay, so from looking at her, from looking at her right on, I can tell that there's normal cephalic in her head. Okay, I'm just going to go ahead and feel your head. Is there any tenderness or pain that you feel? Okay. Even distribution of hair is noted. All right. From here, I'm going to palpate the temporal arteries. Any pain or tenderness?
No.
Okay. Temporal arteries are bilaterally felt, and they're strong on each side. If you have any tenderness or pain or uncomfortable at all, just let me know during this. Okay, from here, okay, I'm going to go ahead and have you smile for me. Okay, can you frown? Okay, I'm going to have you puff out your cheeks, so I'm going to push against them. Okay, and you can go ahead and let the air out when I do so. Okay, I see even facial expressions, symmetric features in your face, which is good. Okay, can I have you push your jaw against my hand on this side? Okay, awesome. And now on this side. All right, good job. I'm going to go ahead and feel your TMJ back here and try to push it forward. Okay, that feels good. Any pain there, anything like that? Okay, awesome. All right. Okay, I will be right back. All right, if you can go ahead and close your eyes and just pay attention to the feeling you get. Okay? Tell me, do you feel it? Do you feel it?
Yes.
Okay, do you feel it?
Yes.
Okay, do you feel it?
Yes.
Okay, were they about similar, equal? You can open your eyes now.
They're equal.
Okay, awesome. Okay, also something I'd like to note is that she looks like she's in very good personal hygiene. Okay, they're about equal. Awesome. Okay. Okay, awesome. All right, so I'm going to get one thing over here, and we're going to go ahead and check this. All right, so before I go ahead and check your ears, I'm just going to check your sinuses. So I'm just going to press on them. Tell me, do you feel any pain?
No.
Okay, awesome. All right, so you can go ahead and open your eyes. Okay, so when I'm just looking at her eyes, I notice that her conjunctiva are clear. I'm going to just pull on your eyelid here. That the lower lids are pink. I notice that her sclera is white with no yellow spots. I notice that her irises, they have even coloration, that her pupils are bilaterally round and regular in shape. I'm going to shine this light in your eye. Okay. And okay, and bilaterally equal to light as well. Um, I also can note that I'm going to now use my ophthalmoscope to go ahead and just look into your eye and see what I see there. I expect to be able to see a symmetrical red reflex in each eye, as well as a orange yellow lens, a lighter red background. I also expect to see retinal vessels, an artery, and a vein in each of the quadrants when I look into your eye, with the veins being slightly wider than the arteries. Okay, so I'm going to go ahead and have you just look over there at some fixed spot, and I'm just going to go ahead and look in your eye. All right. Okay. Okay. And now I'm going to go ahead and take a look at your ears. When I'm looking at your ears right now, I can see that there's no deformities, no ulcers, no lesions, or any abnormalities there. Okay. All right. Okay. Move to the side. Okay. I can see that her ear canals are clear with no foreign bodies or excess rumen lodged in there. I can also see that there was a translucent, shiny tympanic membrane there. Okay, back. Okay. All right. So I'm going to go ahead and have you please just follow my fingers. Just hold your head still and just follow my fingers with your eyes, please. Okay. All right. I'm going to make you cross your eyes a little bit. All right. Awesome. Okay. Can you see my fingers?
No.
Okay. So tell me when you can.
Yes.
Okay. Can you see my fingers?
No.
Okay. So tell me when
Yes.
you can. Okay. Awesome. All right. So one last thing I'm going to have you do there is just to check your vision. I'm going to have you hold this about 14 centimeters, so about right here. Okay, awesome. And then tell me, can you read this bottom line?
428739 EWM00X3.
All right, good. Awesome. Good job. Okay, good. So that's 2020. Great job there. Okay. So now I'm going to check your hearing a little bit. So I'm going to just place this on the top of your head and just tell me if you hear it a little bit more on one side than the other, if you hear it about equally on both sides.
Okay. I hear it equally on both sides.
Okay, awesome. All right, so now I'm going to just have you move your hair back here. And once I set the tuning fork right here, I'm just going to ask you to tell me when you stop hearing it.
Okay.
And then I'm going to move it up here, and then once again ask you if you hear it there.
Okay. I don't hear it anymore.
Okay, do you hear it now?
Yes.
Awesome. Okay, good. So now I'm going to stand a little bit behind you, and I'm going to whisper a few words.
Okay.
And if you could just repeat them for me, that would be awesome.
Okay.
Okay.
Sunday. Apple. Thanksgiving.
Okay. And I'm going to say a series of a few letters or numbers, and if you could repeat those for me, please.
Okay. S. 22. C.
Okay, awesome. Thank you. Okay. All right. Okay. So now I'm going to go ahead and have you close your eyes for me. Okay. Now I'm going to have you just tell me if you smell anything and if you do, what you smell.
Alcohol wipe.
Yeah. Awesome. Good job. Okay. So you can open your eyes now. So just by looking at your nose, I can see that there's a little bit off-centered, but not too much. So I'm going to go ahead and just check for the patency of your nares. Okay. Okay. I can see that her left nair is a little bit less patent than her right nair, as there seems to be a little bit of septum deviation to your left. Um, Also can see that the turbinates are not excessively red or swollen or boggy, and that your mucous membranes seem to be moist and appropriately pink. Okay, so now I'm going to go ahead and take a look inside your mouth. So if you could just open up, and I'm going to go ahead and just look in there. All right. Okay. Okay, could you say ah for me, please? All right, stick out your tongue. Okay, awesome. So I noticed that your uvula is hanging midline, that your soft palate rises also midline, that your hard palate is more lighter in color, more transverse organ. Could you go ahead and stick out your tongue and move it from right to left for me, please? Okay, and up and down. All right, okay. I'm going to go ahead and okay, I'm gonna have you close your eyes, and I'm just gonna have you. Hopefully, this won't taste too bad to you. Just taste this for me, please. Okay. Okay, what do you taste?
Sugar.
Okay, awesome, good. Okay, now you can go ahead and open your eyes. I'm just gonna go ahead and look inside your mouth a little bit now. You have sugar in your mouth, and just see if there's anything going on there. Okay, awesome. The teeth look good. So you have a very good, straight, clean. So you have an internal retainer, which is awesome. And your gums look good, no abnormal ulceration or bleeding there. Okay? All right. Okay, so now I can see that your neck is midline, looks good. I'm going to go ahead and palpate some of your lymph nodes, okay? So tell me if you have any pain or tingling. Okay, no node enlargement here. Okay, checking for skin turgor. Skin turgor looks great. Could you go ahead and shrug your shoulders a few times for me? Okay, awesome. Now could you shrug against resistance? Okay, great. All right. From here, I'm gonna grab one more thing. All right, awesome. Okay, so I'm gonna check my sheet really quick. Oh, okay. So now I'm gonna go ahead and just feel your carotid pulse. Good and bilateral strong. I don't see any tracheal deviation of any sort. Okay. Can I go ahead and have you just lean your head against my hand on this side? All right, good job. And on this side. All right, good job. Okay, now I'm going to have you. Would you face that way for me so I can be behind you? And I'm going to go ahead and palpate your trachea a little bit. All right, could you swallow for me, please? All right, awesome. Okay, so now. Okay, so now I'm going to go ahead and listen to some of your lung sounds on your back. And so if I could just, is it okay if I lift up and shift? I'm sorry, I know it's a little cold in here. Okay, so I'm gonna go ahead and as I'm just looking at everything, everything looks good. I'm ready to see if you have any tenderness or pain. Any response. Okay, is there any pain or tenderness here? Awesome. All right, so also when I'm looking here and seeing that spinal processes look good, they look like they're in a straight line. Okay, so I'm going to just have you say 99 every time I touch, okay? Go ahead.
99,
Okay,
99,
okay,
99,
okay,
99,
okay,
99,
okay,
99,
okay. And then I'm just going to get rid of all that. Okay, go ahead.
99,
Okay,
99,
okay,
99,
okay,
99,
okay,
99,
okay.
99,
Okay, let's finish that with you.
99,
Alright, awesome.
99,
Awesome. No abnormal tactile sensitive spot there. Okay, so now I'm going to mark on your back if that's okay. Okay, so I'm just going to have you take a deep breath out and hold it, please. You can go ahead and breathe in now. And now I'm going to have you take a deep breath in and hold it, please. Alright, go ahead and breathe in. Diaphragmatic excursion looks good. And you expect it to be a little bit higher on the right side than the left side if you were going to be showing both on this video. All right, awesome. Okay, so I'm going to go ahead and press it to your lung fields a little bit. All right. No abnormal dullness or hyperresonance noted. Okay, I'm going to go ahead and listen to your voice now. So each time my stethoscope touches you, you could just breathe in and out. That would be awesome. All right. Okay. I notice like a thoracic page, like there's liquidation. I see that the ribs are downward sloping as well. Okay. Um, all right. So that looks good. I'm going to for 1 second. All right. Okay. So I'm going to have you just take a deep breath in and out for me. Okay. I see symmetrical expansion as well as symmetrical just general features of your back, which is awesome already. And I'm going to go ahead and listen to you one more time. Just go ahead and breathe in and out. All right, awesome. No adventitious sounds noted. Okay. And again, tell me if you feel any irritability. No abnormal lumps or masses. awesome. Okay, so now if I could just have you turn back around and face me. And now we're going to do generally the same thing in the front now, okay? So if I could have you just lift up your shirt for me, please. All right, awesome. Okay, so I'm going to start off just kind of, just very quietly. Just a little bit of palpation. Trying to feel pain, tenderness, and okay, awesome. Okay, so I'm going to go ahead and have you say 99 next time. Okay?
99,
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 Okay? And then just kind of round it out.
99,
Okay?
99.
All right. Okay, that probably just feels good. I'm gonna do a few more things on the front. So I have a lift up your shirt one more time. Sorry. Okay, so I'm gonna go ahead and have you just take a deep breath in and out. Okay, symmetrical expansion noted as well as symmetrical features. Again, noting the elliptical shape with thoracic cage with the downward sloping ribs. Okay, awesome. Okay, so I'm once again going to mark on you if that's okay. So I'm going to have you go ahead and take a deep breath out and hold it. Okay, go ahead and breathe in there. Okay, and now this time, again, I'm going to have you take a deep breath in and out. Excursion looks good once again. Okay. So now if you want to, okay, if, so now I'm going to just go ahead and take a listen. So if you could just breathe in and out, please. Okay, in and out, please. Okay, in and out. Okay, in and out. Okay, in and out. Okay, in and out. In and out. In and out. All right, awesome. Okay, so okay, so now I'm going to go ahead and I'm going to feel for your ankle pulse, okay? So just kind of fit and across the space and the good. Okay, awesome. It feels good. It feels strong. Respiratory rate noted to be about 15 respirations per minute. All right. Okay. So that should be good. Now I'm going to go ahead and listen to your heart sounds. Okay. It tickles. It's okay. Okay. Awesome. So with that S1 and S2 noted, S1 being a little bit louder, if I would have been listening for a full minute, I would have noted that her heart rate would have been around 65, 67. Okay, awesome. Okay, so you can go ahead and put on your shirt. Okay. Okay, so last thing before we go ahead and let you lay down is that I'm just going to note that you had no adventitious breath sounds, nothing out of the ordinary. Also, that your heart rate sounded like a normal rhythm. No murmurs or anything else noted. Okay, so if you can go ahead and you can lay down on your back for me with your head there and your feet here, whatever's best for you. All right. Okay, so while I'm here, in order to not block the camera, let's make sure I'm just gonna get down. Okay, so I notice that I don't see any excessive jugular vein distension or jugular venous pressure would be indicated, as I don't see any unexcessive pulsations. I also am not seeing any heaves in the precordium. It did not feel or I did not feel or assess any precordium thrills. So one thing I'm going to have you do actually before you lay down, I'm going to have you sit back up one more time, and I'm going to press your anterior lung field side. Okay. So. Once again, normal dullness or hyperactivity. So, okay, go ahead and lay down for me. Okay, so I'm going to go ahead and lift up your shirt. Alright, so just on looking, I see that her skin again is matching the rest of her body, and it's pinkish white colored, no abnormal coolness or excessive warmth or moisture felt. I see that there's a symmetrical shape of the abdomen, that the umbilicus is midline with no lesions or ulcerations noted. Um, so I also don't see any abnormal pulsations or anything. So I'm going to move down here, and I'm going to go ahead and start by listening to vowel sounds. Alright, so high-pitched epigraph sounds in each quadrant. No extravascular sounds noted. Um, so I'm going to go ahead and percuss over each of these quadrants. Okay, timpani seems to be the noted sound over each of the quadrants. So from here, I'm going to go ahead and percuss for your liver skin. Okay, seems to be about mid-clavicularly around 6 or 12 intercostal spaces, and I'm going to come around here and percuss for the liver. Excuse me. Alright, so I'm noting that I believe I'm percussing your spleen and the mid-axillary line. Okay, so from here I'm going to go ahead and just do some light palpation. You have normal, let me know if you have any tingles, okay? You have normal masses or tenderness noted. I can go ahead and feel the liver here. The patient's a little bit ticklish. I can go ahead and I can feel the liver over here. The palpation, you can feel the spleen a little bit. The kidneys on each side. Some deep palpation of the aorta, which is a little bit hard for this patient because she's a little bit ticklish and cooperating nicely. Alright, so I'm going to go ahead and feel for your femoral pulses. Okay. Feel good on this side also. Okay. They seem to be about bilaterally equal. There seems to be no tickles, no inguinal node enlargement. Alright, awesome. Okay, so alright, so that's good. So I'm gonna go ahead and take a look at your legs, and for that I'm gonna move to the other side in just 1 second. Okay. So I'd also like to say that everything looks good here, so no abdominal reflexes seem to be noted. Okay, so I'm gonna go ahead and take a look at your legs, and your legs seem to be looking good. They're even in skin color and skin tone, just like the rest of her body, that pinkish white color, no abnormal pallor or cyanosis of any sort, which is the same with her chest. There's no abnormal pallor or clamminess or coolness or cyanosis there posteriorly or anteriorly either. Okay, so I'm going to go ahead and her legs feel, it's a little bit chilly in here. They feel good. Feet are a little bit cooler, but not too cold. She had fingernail polish on her toenails, so in the hospital I could use the alcohol to remove those as a checking cap refill. But just by checking with the skin on her feet and feeling the temperature, everything feels good there. Okay, so I'm also going to notice that there's no pretibial edema. So I'm going to go ahead and support the leg and feel for the popliteal pulse, which is felt there, and felt there as well. Okay, so feeling for the dorsalis pedis pulse. The posterior tibial pulses I will be feeling as well. All right. Okay, and that feels good as well. Okay, so I'm going to go ahead and have you push against my hands. Okay, and push against my hands backwards. All right, very nice. Okay, and then I'm sorry. Earlier. I'm so sorry about that. Okay, and you can go ahead and sit up for me. Thank you. Okay, so all right. So also I would just like to say that her legs, they look very symmetrical. Okay, so now I'm going to go ahead and just take a look at your arms, which feel good. They feel nice and warm, nice and strong. I notice that the cap refills bilaterally under 1 second. I also notice that my skin is it's soft, the texture is even and smooth, and I see that once again her color on her arms matches the rest of her body. Okay, so I am first of all going to have you kind of tee out your arms for me, okay, and if you could just resist. Okay, all right, awesome job. Okay, so now I'm going to go ahead and just do a few tests on you to just check how your sensation is. So, first thing I'm going to have you do is I'm going to have you just close your eyes for me, and then I'm going to have you tell me if you feel something as dull or sharp. Okay? Okay. Okay, awesome. I'm going to go ahead and do the same thing down by your feet as well. You can just relax a little bit. Okay, one more down. Okay, no. No. Okay, what about now? Awesome. Okay, right down this side. What about now? No. 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 Awesome. Good job. Okay, so I'm going to go ahead and then now I'm just going to go ahead and check in and see if you can feel the vibration of the tuning fork that we used earlier. So if you can just go ahead and close your eyes for me and then awesome. Good job. Okay. So now I'm going to go ahead and I'm just going to make sure you can see everything we're doing. Okay, so now I'm going to go ahead and have you close your eyes and I'm going to move your finger either up or down and if you could just indicate if you feel as though it's okay. Up. Okay. Down. Up. Down. Up. Down. Up. Down. Same thing with your toes now. Okay. Up. Okay. Down. Up. Okay. Down. Up. Down. Down. Up. Okay. Awesome. Good job. Okay. Now, if you could just touch your thumb to each of your fingers, please. Awesome. And now, if you could just put your hands on the tops of your thighs and just flip them up and down. Okay. Awesome. Good job. Okay, so now I'm going to have you close your eyes one more time, and I'm going to go grab an object, and I'm going to place it in your hand, and then I'm going to have you identify it. So you can all right. Okay, so I'm going to put an object in this hand. I'm going to have you place your hand so you can identify it for me. Okay, awesome. Okay, I'm going to put another object in this hand. You can identify that for me. Okay, awesome. Good job. You can go ahead and open your eyes. Okay, so I'm only going to have you close your eyes a few more times, but for this one, I'm going to have you close your eyes and go ahead and touch one finger to your nose from one hand and then again to the other. Okay. Okay, awesome. Now, if you could go ahead and take your right foot and run it along your left shin and then vice versa. Okay, awesome. Okay, good job. Okay, so now I'm going to go ahead and I'm going to go ahead and check your reflexes. I'm just going to move this so that we can have a little bit more room. All right. Okay. So just go ahead and relax for me. Okay. I'm gonna Okay, good. Okay, just go ahead and relax for me. That's good. Okay, now if you just go back just a little bit, just relax for me. Okay. Okay. Okay, just a little bit ticklish. Okay, okay. Just go ahead. Okay. Okay, good. We won't have to do that one again. Okay, so I'm gonna come and go down here and check down here. Okay, awesome. Now we'll do one more right up. Okay, awesome. Good job. All right, so only a few more tests and then we'll be done. All right. Okay, so I'm gonna go ahead and I'm gonna check one more reflex just to see. Okay, perfect. Negative Babinsky's. Okay, so we're gonna go ahead and pause the video to reposition the camera in order to perform our last test. Okay, so one other thing I'm going to make sure to check is that the cornea looks smooth and clear and no opacity is noted. I'm also going to check for swelling of the epitrochlear nodes, which I do not feel, which is awesome. Okay, so now I'm going to go ahead and have you stand right over here. And I'm going to have you walk, in order to get her, we're having her walk a diagonal straight line. But just go ahead and walk to about right here, just normally for me, please. All right, and then on the way back, I'm going to have you just turn around and just walk heel to toe, heel to toe. All right, awesome. So now on the way back, I'm going to have you go ahead and walk on your tippy toes. All right, and then I'm going to have you walk on your heels for me, please. Okay, that looks awesome. Okay, so we went ahead and noted that she's able to stand up fine by herself without assistance. So I'm going to go ahead and have you just do a shallow knee bend and then back up for me. Okay, awesome. So now I'm going to go ahead and have you just close your eyes and just kind of stand still for me for a little bit. All right, awesome, good job. So now I'm going to go ahead and have you just turn around for me right here. Just go ahead and bend forward and try to touch your toes for me. Okay, awesome. I'm going to lift up your shirt one more time to just look at your spinous processes again. Okay. I can see that they're, once again, a straight line, which is awesome. Okay, you can go ahead and stand back up. So now I'm going to have you just lean to the right for me. Okay, and then lean to the left. Okay, lean forward. Okay, lean backwards. All right, now lean to the right against this resistance for me. Okay, good job. And go ahead and lean to the left. Okay, awesome. All right, so lift this up so we don't cut off our head. I think that is all that we have today. Thank you so much for participating in this process, and thank you as well.